Welcome viewers, I am Dr. Abhik Devnath from PACE Hospitals, Hyderabad. I am urologist, consultant urologist, renal transplant surgeon here at PACE Hospitals. So, first of all, prostate is a gland which is located in the male genitalia just below our urinary bladder. So, this gland is like the shape of a water chestnut, or it's like an elliptical or ovoid shaped organ. And usually it causes no problem and it just contributes to some secretions in our semen. Usually the size of a normal prostate gland is about 18 to 20 grams. Clinically we say that the prostate gland is enlarged when it is about 25 to 30 grams or 25 to 30 cc in size. It is important to realize that the growth of prostate gland is an age-related phenomenon. Usually the growth of prostate starts by about late 40s and it continues till the end. So usually with advanced age and with the aging population, the size of the prostate is generally more. And with every decade passing, the prostate size grows in size. Apart from this, there are some risk factors like central obesity or what we call abdominal obesity, which leads to enlargement of the prostate. Along with that, it is said that recurrent urinary infections can also cause some fibrosis of the prostate and enlargement and symptoms. There is some evidence that due to hormonal fluctuations, local growth factors also play an important role in the enlargement of prostate. So, together we have the systemic hormones, that is the testosterone and estradiol, along with local growth factors like keratinocyte growth factor, epidermal growth factor and insulin-like growth factor. They together contribute in the cell death and cell formation inside the prostate, the balance of which, if it gets disturbed, then we get the enlargement of prostate. Apart from this, there is certain familial tendency also to get enlargement of prostate. It is said that usually if the age is less than 60 years and if men have symptoms of prostate, then almost 50% of them it is related to or attributed to familial occurrence. Young age means I would suggest it is less than 60 years. So, in any male who is less than 60 years and he has urinary symptoms in terms of poor flow or frequency and it is likely attributable to its enlarged prostate, then it is most likely due to familial occurrence. It is said that the usual pattern of inheritance of this kind of phenomenon is an autosomal dominant one. And in less than 60 years, if prostate symptoms occur, it is said that up to 50% of them is because of genetic or familial association. Usually an enlarged prostate can cause urinary symptoms. Urinary symptoms can be either storage type or voiding type or post-micturition type. Storage type symptoms means that the urine is unable to store urine, and whenever there is a little bit of urinary urine collecting or pooling in the bladder, then there is symptoms of irritation which are in the form of frequency, urgency, nighttime urinary voiding and urge incontinence. Apart from that, there can be voiding symptoms as well, which includes hesitancy in which there is difficulty in the initiation of stream, there is poor flow and there is intermittency, that is the flow is stopping and again starting, or there will be straining, that is we have to force to pass urine or generate a good stream of urine. Apart from that, after urination also there are some symptoms which can happen, which is called post-micturition dribble. That means after passing urine there is dribbling of urine, that is drops of urine are passing and it is causing soakage of the undergarments. And also there is one more symptom which is called incomplete voiding. That means even after passing urine, we feel that we have not emptied the bladder fully. Enlarged prostate can cause a lot of quality of life issues. When a person is leaking urine, it can affect his physical and mental quality of life. Apart from this, it can cause certain other complications, like it can cause recurrent urinary tract infections, and it can also cause bleeding in the urine, which is called BPE or BPH related hematuria. It can also obstruct the passage of urine and ultimately lead to deterioration of bladder function, and also can cause obstruction and dilatation of the ureters and the calyceal system of the kidney, causing hydronephrosis. And long standing hydronephrosis can impair renal function as well, can cause increase in serum creatinine and renal failure. The first thing is the symptoms. When an elderly person, an elderly man is having difficulty in his voiding, either in the form of storage symptoms or voiding symptoms, it's easy and it's very straightforward to consult the nearest urologist. The first diagnosis is made by the clinical impression of a urologist. Urologist will take a meticulous history and do a physical examination, which includes a digital rectal examination. In that, the physician will insert his finger into the patient's rectum gently and palpate the enlargement of the prostate. Apart from that, simple tests like an ultrasound can diagnose the enlargement of the prostate. Finally, to characterize the exact enlargement and to know whether there are signs of cancer or not, an MRI of the prostate may be done. Rather, I should say, the treatment is for the symptoms of the patient and not for just the enlargement of the prostate. So, usual line of treatment is a lifestyle modification, in which we advise the patient to drink little less amount of water, to avoid irritants like spicy food and caffeine containing products like tea and coffee. And apart from that, there is a little behavioral change which is to be adopted, like timed and double voiding, like fluid restriction after 5 or 6 p.m. in the evening, and also there are some medications available which includes alpha blockers and PDE5 inhibitors. And if the gland size is large, then we usually prescribe a 5' ARI inhibitor or a combination therapy which consists of a 5' ARI and also an alpha blocker. Apart from this medical treatment, there are surgical treatments also available for enlargement of the prostate, which includes usually the transurethral resection of prostate, which can be done by monopolar or bipolar current. It can also be done using laser, and it can also be done by open surgery. The gold standard endoscopic treatment for enlarged prostate is called the TURP, or the transurethral resection of prostate. It is usually done for glands up to 60 to 70 gram in size. However, in expert hands it can be done even for larger glands. It can be done using monopolar or bipolar current. With bipolar current, there is less risk or no risk of electrolyte imbalance, and resections can be even done for larger glands. However, for those who have coagulopathies, laser enucleation of prostate or HOLEP or THULEP is preferable. Apart from this, open surgical techniques are also available, in which for very enlarged glands, open surgery is contemplated to remove or enucleate the gland. Usually, prostate enlargement is an age-related phenomenon, but there are certain measures which we can adopt, like we can avoid fatty food in our diet, because it is shown that non-alcoholic fatty liver disease also is associated with enlargement of prostate, and central obesity or abdominal obesity also leads to or has correlation with enlargement of prostate. So, basically we have to prevent gaining weight and obesity. So, some lifestyle measures can be taken to avoid symptoms related to enlargement of prostate. However, it is an age and more of a family related situation or a condition which may be difficult to actually avoid, but we can delay its occurrence by these lifestyle modifications. I would suggest just to maintain a lifestyle with balanced diet, high fiber content in food, so that constipation can be avoided, and fluid restriction to up to about 2 liters a day with prevention or avoidance of oily and spicy food and fatty foods. This will prevent in gaining weight and obesity, and also preventing spicy food will also prevent irritative symptoms, and we can also avoid caffeine, that is tea and coffee, or limit its intake so that storage symptoms can be controlled. In most of the cases, no, because usually enlargement of prostate can be controlled with lifestyle modifications, with some behavioral changes, and with medical treatment in most cases. In some cases, however, the enlarged prostate can cause repeated urinary infections, bleeding in the urination, and obstruction to the kidney and dilatation, causing kidney damage. In those cases, it is detrimental to health, and most often in those cases it demands surgery for the enlarged prostate. No, most of the prostate enlargements are benign, and that is why we call it BPH, benign prostatic hyperplasia. Benign means it is non-cancerous. However, in the foci of the enlarged prostate, there can be an area of malignancy, but it is not always the case. And also to remind you that most of the prostate cancers are not dangerous to life. They will remain inside the prostate for the rest of the lifetime. Only a very small group of prostate cancers are aggressive and they show up immediately, and it can be well palpated by a clinician by a astute examination when he feels a hard nodule inside the prostate, or when the PSA, which is a blood test, shows abnormal elevation. Enlarged prostate can be cured. Its symptoms can be controlled with the help of lifestyle modifications and medical treatments available, and when these treatments are not successful, surgery can be done. So, in the surgery, especially today nowadays we do the endoscopic surgery, we remove or core out the prostate from inside the urethra, and we leave the capsule and the lining peripheral zone inside the body. So, the main part which is causing the obstruction in the urinary passage, that is the periurethral transitional zone, that part of the prostate and the central area of the prostate is cored out by an endoscopic surgery. There is a relation between sexual activity and prostate enlargement. Of course, both are related to age. With advanced age, sexual activity and sexual dysfunction occurs, and therefore an elderly person is expected to have erectile dysfunction and ejaculatory dysfunction, and also decreased libido. Also, with an advanced age, the chances of prostate enlargement is also high. So, the cause and effect relation is not well known, but it is said that benign prostatic enlargement and sexual dysfunction can both coexist, and probably both are interrelated to each other. Enlarged prostate usually does not affect sperm count, but it can cause ejaculatory dysfunction. Enlarged prostate can cause difficulty in passing urine. Apart from that, it can cause repeated urinary tract infection. When infection occurs in the urinary tract, or when urinary infection occurs, it can cause burning in urination. Exact cause-effect relationship is not established, but it is said that usually these two, sexual dysfunction in the form of erectile dysfunction and prostatism or benign enlargement of the prostate, are age related, and both can occur in a patient, and usually there is a interrelationship between the two. So, it is likely that a patient who has enlarged prostate can also have erectile dysfunction, and in them usually the preferred line of treatment is the use of a PDE5 inhibitor, sildenafil or tadalafil, which addresses both these components. Yes, certainly it can. In a small subgroup of patients who have enlargement of prostate, this enlarged prostate can grow and can cause impairment in the urinary passage, and with increase in the volume of residual urine, it can increase in bladder pressure, and this pressure can be transmitted upwards and can cause obstruction in the flow of urine from kidney to downwards, and can cause hydronephrosis and can cause fluid retention in the body and can even cause renal failure. Prostate is situated just in front of our rectum, so just in front of our distal bowel. So many may think that with prostate enlargement, will it cause any problem in passing motions? But actually there is no direct relationship to it, but it is just that with age and increasing incidence of diabetes, there is an concomitant occurrence of constipation. So those patients who have enlargement of prostate and symptoms related to enlargement of prostate, they tend to have constipation as well, but there is no direct relationship between the two. Yes, enlarged prostate can cause obstruction to urinary passage, can cause hydronephrosis in both kidneys, fluid retention and rise in serum creatinine. Enlarged prostate usually is not related to sciatic nerve or its course. However, there may be a component of neurogenic back pain associated along with benign prostatic enlargement, especially in elderly individuals who have lumbar disc disease or who have sacral disc disease. In them, there can be associated sciatic nerve pain, but that is because of a back issue or a disc disease or a spine disease rather than because of prostate enlargement. It is just that these are phenomenon of old age, and that is why both can coexist. There is no direct evidence for this, but we have seen that in those men who have bothersome symptoms and we do a prostate surgery in them because of benign prostatic enlargement, we see that many biopsies show evidence of inflammation and infection. Therefore, anecdotally we can say, or retrospectively we can say that yes, repeated urinary infections can lead to some fibrosis and growth of the prostate gland and can cause symptoms, and maybe repeated infections and benign prostatic enlargement have some link, but direct causative effect has not been established. Enlarged prostate, it's very difficult to say. It may not shrink on its own, but there are medications which can decrease the size of the prostate. The best known medicine is the 5' ARI, which includes the dutasteride and the finasteride. So these drugs are known to decrease the size of the prostate. In both PLES study and the MTOP study, which is published in the New England Journal of Medicine in 1998 and 2003 respectively, they have shown that over a 4-year period, when we take these drugs, alpha reductase inhibitors, then it decreases the size of the prostate by about 18 to 19%.